Do you have bags, puffiness, extra skin, and generally are not happy with the appearance of your lower eyelid? If yes, you're probably thinking of scheduling a consultation for lower eyelid blepharoplasty. Here's my approach to rejuvenating the lower eyelids. I often discuss a multi-layered approach. So the first layer number one that I focus on is fat. Fat is what makes the bags of the lower eyelid visible. Rather than removing the fat, like many surgeons prefer to do, my choice is to reuse and reposition it. This allows me to soften the tear trough, which usually becomes more apparent with age, and avoid additional hollowing after surgery. In order to access the fat, the incision is made on the inside of the lower eyelid through the conjunctiva, known as a transconjunctival incision. If this is all that's required in the procedure, then the lower eyelid blepharoplasty with fat repositioning is essentially an invisible hidden scar. Now, in cases of more severe aging where we see extra loose skin, sagging skin, and some muscle sag, we start to get into layers number 2 and 3, which is skin and muscle. What I like to do is to lift that in one composite flap, which allows me to also trim any excess skin that comes up with it. This will require a small incision right in the lash line underneath the lower lashes, and it hides well in that shadow. The final and fourth layer comes into play in more advanced cases of aging or as an insurance policy for what happens during swelling and recovery. This is an advanced technique. I like to address the ligament of the lower eyelid, the apparatus that kind of holds everything in its place. And I like to perform a canthopexy, which is a tightening of the lateral connection of the eyelid to the bone. This gives the lower eyelid support, strength, and a recovery position that is natural and will not predispose the eyelid to dragging down, or as we call that, malposition. This is an important step to consider and one that I often include to give patients the best and most optimal result. These are examples of my patients who underwent lower eyelid fat repositioning.